I would like to read the bio of Maéva Blot, who works as a pharmacist at the Royal Victoria Hospital, showcasing her dedication to patient care and her expertise in medication management. She works in the geriatric consultation service and educates patients, their families, and healthcare professors regarding potentially inappropriate and omitted medications in older adults. She also has a practice in cardiac surgery and clinical studies. Overall, Maéva's diverse roles allows her to improve medication safety and efficiency to enhance the quality of life for patients with complex medical needs.
Thank you for the lovely introduction, and thank you everyone for being here today. I'm very happy to speak about one of the topics that interests me the most, which is medications in the elderly. I will be presenting today about do I still need this medication, deprescribing, and safe use of medications. So our plan for today is to explain why we become more sensitive to the effects of medication with age, identify situations where the potential harms of medications may outweigh their benefits, and also to describe how patients, caregivers, their family, the healthcare professionals can work together to decrease the harm for patient safety. So acknowledging that this presentation is possible thanks to different organizations such as the MHC, the EUGM, and the Network for Deprescribing. I have no conflicts of interest to disclose. Okay, and as we said at the beginning of this presentation, we are on unceded territory of the Autochthone nations as well. Okay. So we're committed to building strong relationships with Indigenous communities and to co-creating initiatives that reflect community priorities around medication use, rooted in Indigenous ways of knowing, doing, and being. So why do you have to take medications? Of course, I became a pharmacist because I believe in the power of medications. Medications can cure disease, like infections. They can also manage chronic conditions like high blood pressure, diabetes. They can be relieving your symptoms if you have chronic pain, acute pain, if you develop fever, and they can definitely prolong life expectancy. So please don't stop taking your medications after this presentation. This is not the goal. It's more to put the light on some medications that may be harmful as we get older, and some medications might need to be reduced or stopped, but in a very methodological way. So why all the fuss about this? So what percentage of community-dwelling older adults in Canada take 5 or more prescription medications? As you can see, it's close to 3 adults out of 5. And 10 or more prescription medications is about 1 adult out of 5. And as we age, so people over 85 in Canada that can take 10 or more medications, that's about 2 adults out of 5. So why does aging make us more sensitive to medications? So, of course, we often need more medication to manage chronic conditions as we're aging, but the benefits and the risks of those medications may change. As we age, the brain becomes more sensitive to the medications. We have the blood-brain barrier that's more permeable to some molecules, so the molecules go in the brain and the side effects may be worse. That's one of them. Of course, there's also less muscle and more body fat, so the distribution of the medication is also changing. And the liver and kidneys may be affected. Your liver is metabolizing most of the medication, and most medications also get excreted by the kidneys. So if your kidneys are functioning less, then you may accumulate those medications. What is medication overload and why does it matter? So it means that you're taking a combination of medications that does more harm than good, and it can increase the risk of harmful effects. So when we talk about medications, we're not only talking about the medications that were prescribed to you, we're also talking about over-the-counter medications. We're also talking about natural health products because there can be some interactions. And it's really important to consider everything you're taking, the prescribed medication and the natural health products, and to see with your pharmacist, nurse practitioner, or doctor if there are some interactions that can be harmful for you. As you can imagine, medication overload may increase your risk for falls, fractures, memory issues, hospitalizations, and as I just spoke about interactions between medications. The side effects, unfortunately, they can represent 6 to 12% of hospitalizations in older adults, and over half of them are avoidable. This is the reason why it's so important to review medications as we age and as our chronic conditions may resolve. So there's also a higher risk of forgetting medications, but also making mistakes while you're taking the medications. Natural health products, traditional medicines, over-the-counter medications, all of this is considered medications, and when we take them, we need to think, is it beneficial for me, or is it harmful, and is the combination making it worse, or is it making it better? And that's the reason why when we go and speak to our practitioners and we say, this is my list of medications, we should also be thinking of, well, I also like to take cranberry capsules and magnesium capsules as well, because there could be some interactions with your prescribed medications. Also, cannabis, alcohol, other recreational drugs, they can also be interacting with current medications. So we should be letting our healthcare professionals know about that use as well. And some medications may be considered risky because they outweigh the potential benefits. So those are considered potentially inappropriate medications in the pharmacotherapy. And we have to think that sleeping pills, they're risky. It's hard because as we get older, we are producing less melatonin as well, so it's harder to fall asleep. There are different concerns that we can have, and we may go towards the sleeping pills. But sleeping pills, they can affect memory, coordination, they can increase the risk for falls as well, they can affect your concentration. So they do have benefits, and some are safer than others, but we need to reassess the need for those medications and also what else could we be doing to improve the sleep. So, as non-pharmacological ways, there is sleep therapy and cognitive behavioral therapy that could be helpful for insomnia. And there's also mysleepwell.ca, which is a Canadian-based organization promoting sleep therapy and gives different advice of how to fall asleep, what's the routine that we should be following just before we go to bed. Things are very simple, like avoiding to eat in the 2 hours before falling asleep, or avoiding the screens like phones, TV, computers. That can all interfere with the production of endogenous melatonin and interfere with your sleep quality as well. So how many Canadians over 65 years old take at least one potentially inappropriate medication? 38% of men and 48% of women. So we're a little close, but I also have to consider in there that women live longer than men, so maybe there is a proportion there that's attributable as well to the fact that women live longer than men. Canada spends over $1 billion per year for potentially a harmful prescription medication, and it does not even include the hospital costs. So it's really, really important to review medications because as much as they can be beneficial, they can also be harmful. So how can patients, caregivers, and healthcare professionals work together to prevent harm from medications? We can talk here about deprescribing. Deprescribing is a pharmacology action that I do every day in my geriatrics practice. And it means either to reduce or to taper some medications that can be harmful. And the deprescription process is the most successful when you engage the patients, their family, and the other healthcare professionals. It's not something that should be done by just looking at the list of medications and identifying this as increasing your risk of falls. This can increase the difficulties with concentration, so I'm going to stop it. No. We have to discuss with the patients and their families why they are taking their medications. Do they think that this medication is helping them? Do they think that it's not helping them? And then with this discussion, we can figure out a plan to deprescribe. So, medications are prescribed, then they get reassessed. Should we be continuing this medication? We reassess again. Finally, this medication should be stopped, and we get to the deprescribing point. So, definitely, medication reviews. It's not something that's simple to do. In my practice, there are many patients that take more than 10 medications. So I cannot go there and in 5 minutes or 15 minutes I'm done. That's not how it works. I have to spend at least a half an hour to speak with the patient, and also sometimes I cannot speak with the patient directly. I have to call their family to get more information. So it's a very good opportunity to discuss the importance of either stopping or reducing the medication. If ever you are interested in reducing your medication, you can book an appointment either with your doctor or your nurse practitioner or your pharmacist, and you can look at all the medications that you're taking, why you are taking them, and if there are some that are no longer indicated for you. For example, when you're 40 years old, your target for diabetes control is much lower than when you're 85 years old. And why is that? Well, the literature shows that if diabetes is too well controlled in older populations with risk of falling, then it can be harmful for them. And also, they see that the longer you have a diabetes that is not treated, the higher the chance of developing complications from your diabetes. Also, when your diabetes is too well controlled, then you have risk of having low blood sugar, and then low blood sugar increases your risk of falls, increases your risk of confusion. So we need to think what's the benefits, but also what are the risks of those medications, and we have to think really globally. So you come prepared, you have your list of over-the-counter, supplements, vitamins, natural health products, traditional medicines, prescribed medications. The healthcare professionals will have that. And think of it before you go to that appointment. How are my medications affecting me? Am I having problems with them? And when we talk about medications, we're not only talking about the pill forms, we're also talking about inhalers, eye drops, creams, and sometimes it's not about only why am I taking this medication, but how am I taking the medication. If you have eye drops and you have difficulties with motricity, you can have an equipment, a special equipment that helps you with squeezing your eye drops. So that's something that exists, but if you don't talk about the fact that every time you're putting your eye drops, well, the eye drops fall on the side, then it won't be possible to optimize the eye drop administration. So you have to think not only about if this medication is helpful, but also how am I taking the medication, and am I actually able to take it? So here are 5 different questions. So why am I taking this medication? What are the potential benefits and harms? Can it affect my memory or cause me to fall? Can I stop or reduce any of those medications? And who do I follow up with and when? Because let's say today everything's going well, I'm decreasing a medication for sleep, but I have been taking that medication for over 30 years. If the decrease in that medication is too fast, especially benzodiazepines, so for example, Ativan, Xanax, and the likes, it can cause more harm than beneficials, you know? So it's really important to have a plan, to follow up, and to monitor, do I have any withdrawal effects when I'm decreasing the medication? So it's really a work with the team, and it's patient, caregiver, it's a collaborative care, it involves the healthcare providers, and it's really together that we come up with a plan, but very important to have also a follow-up plan. Can you think of any barriers, worries, challenges to asking your healthcare professional about deprescribing? So, what if my healthcare provider doesn't have time? What if my family doctor doesn't want to change the specialist medication? Can I ask about a medication that has shown no adverse effect? What if my symptoms return when I stop the medication? So you can definitely inform yourself, engage in a discussion, and also spread the word about deprescribing to your friends, family, advocacy group, and government representations. You have to ask questions, stay active. You are in control of what you're taking at the end of the day, and you are the one who knows how those medications feel for you. If you feel like they're causing you harm, discuss it. You are really in power of changing your pharmacotherapy. So I also put in those medication safety and deprescribing resources in the presentation. You can see that there are some different guidelines from the Deprescribing Network about how to go about deprescription, what are the statistics, and how to deal with polypharmacy. Also, quick safety tips to manage medications and all that. You can also look at some workshop series on deprescribing.org about talking about your medications. And I'll be taking some questions and answering anything. If you have some comments for me, I'll be very happy to do so. Thank you.
So much. Very, very informative. And Maeva, one thing that is also important is temperature and extreme heats and sun, and how our medications can be impacted with that.
Yes, yes. If you are in extreme heat and you are taking some medications that can affect your kidney function, you should be speaking to your pharmacist about which ones should you be holding. If you have also a gastroenteritis, if you have a lot of loose stools, there are some medications that should be held as well. You should speak to your pharmacist about that, because you probably know it will leave within 2 to 3 days. And if it does, that's perfect, you know, to hydrate a lot, to eat small portions. But some medications, when your volume is lower, it can accumulate in your body, and it can also harm your kidneys. So as soon as you have a change in your condition, you can either speak with your nurse practitioner, a doctor or a pharmacist as well, because we are very knowledgeable about which medication should be held in those circumstances.
Thank you very, very much for this. It's really, really salient. I'm a retired nurse and was responsible for handing out the medications that are prescribed and would often see very interesting reactions and have to report them. You have to be very careful on the ward. But then something very interesting personally happened. I have had to take Synthroid for 45 years, and the need for it reduces as we pass menopause and age. And my Synthroid was never reduced. So I went into thyrotoxicosis, which I identified myself. Now, I was a nurse that worked in the north, and so we had a lot of prescriptions that we were allowed to prescribe, not the hormones. And so I never really studied Synthroid until I suddenly came into this terrible problem. But it affected several bodily functions, including brain function, and the synapses just did not connect in thyrotoxicosis, and I made terrible mistakes of judgment, work mistakes, family mistakes, health mistakes, financial mistakes. It was just, my life became an absolute disaster. And finally, I did find a doctor who would listen to me after 6, 7, 8, 9 requests and many years, and he reduced it. And, when I asked him if that could be the problem producing all these symptoms, he said, well, let's see. And he turned on the computer and checked the dosages, and oh my goodness, your thyrotoxicosis reduced it. When I went back, he said, your ideation is completely different. And it was, I could just feel an incredible change in myself and thinking, and so it was just absolutely awful. Then in my research on this, I found that in Europe, lower doses of Synthroid are prescribed, according to the blood work, than they are in North America. So I'm wondering if you have seen anything of that nature.
Yes. Okay, so here in Canada, we follow as well our neighbors in the United States, and we have an American Thyroid Association who has lowered the thyroid-stimulating hormone targets for North American populations over 75 years old, because when the Synthroid dose is too high, it's also associated with arrhythmias, so cardiac rhythm abnormalities, but also increases the risk of osteoporosis. So after 75 years old, we do be careful. We retitrate the TSH, and we have to adjust the dose of Synthroid. And some patients are not over 75 years old, but because they present those symptoms, we have to think about this possibility as well.
When you take all these pills, one lady told me that she take 12 pills a day. Would that have interference with the blood? 12 pills every day?
Yes, so it depends what the medications are, of course, but it can have some interference. And we always say it's so easy to prescribe a medications, but much more complex to take it out of the list of medications.
Yeah, but what I'm saying, if you take 12, and that's what? 12 pills a day for even 1 week. I think that have a lot to do with the blood.
It can be with blood-related, kidney function, liver function, and it depends what the medications are, and it also depends of the evaluation of benefits versus risks of those medications. But over 10 medications, I start questioning if they're all supposed to be there, for sure.
One thing I would like to maybe highlight is that when a doctor prescribes a medication, it would be nice if they could tell us what the potential side effects are before we go and fill the prescription. Give you a very brief example. I have COPD. I was given a puffer. Little did I find out when I went to my ophthalmologist that I suddenly had glaucoma in both eyes because of the puffer. Now, there isn't a choice because both have to be treated, but it would have been nice to have known that in advance.
My question is, in Canada, is there an issue, or how much of an issue, with pharmaceutical manufacturers trying to visit doctors to push their products?
Yeah, well, there is this issue for sure, unfortunately, but at the same time, with the deontology codes of each practitioners, like even in a community pharmacy, sometimes they come in and they tell us like, oh, this new product is much better than the older products. You should change all your patients to that new product. But with our deontology code and our ethics of work, we have to look at the literature. We need to know, is this medication really much better than the older ones? What's the advantage? What are the risks? So we have to always rethink of that before prescribing any medications.
I want to find out specifically what's the difference between the physical medication and cream medications.
Oral medication versus cream medication? things
Exactly.
Like that? Okay. One of the differences is definitely in the absorption of the medication. So, as you have a medication like Voltaren, for example. Voltaren can be taken as a cream, but Voltaren, diclofenac, can also be taken as a pill form. Okay, so when you take diclofenac, which is in the same family as Advil, Motrin, ibuprofen, okay, you may have some risks on your cardiac function. You can also have some risk on your kidney function. You can have risk on your stomach function because it can increase your blood pressure. It can also cause issues with the ability of your kidneys to eliminate the water. And it can also increase your risk of bleeding from your stomach. Of course, diclofenac is an anti-inflammatory, so it can help with the pain. However, when you have some comorbidities that can be bad for your heart, your kidneys, or your stomach, you may think, well, let me try the Voltaren instead. Because the absorption of the Voltaren is lower, it's also localized to the area that you're putting the cream on. So, and some people, they also say that their pain is better controlled when they take the Voltaren in cream rather than in the pill, because there's also the massage that's going into it, the pressure that's going into it. So it's mostly about the absorption, but also about the side effects, the difference.
Okay, one more thing I want to ask, actually two. The specific explanation about metformin, and the other one is how long should a person stay on antidepressants?
Question. Very good questions. Okay, so your metformin is basically helping you with the diabetes control. Okay, and it's acting on your pancreas, so it helps with also sensitizing your cells to better, how to say, uptake the insulin and reduce your glycemias. Okay, but also for the question about the antidepressants, is that? Okay. For your antidepressants, that's a very, very good question, and we have different écoles de pensée, schools of thoughts. There you go. The schools of thoughts, because we see in our psychiatry class that some patients will have one episode of depression, and it will resolve within 6 to 12 months, and that will be it for them. We also see that starting after 2 recurrences of depression, there is a higher chance that this patient will need to stay on antidepressants for a longer time. But we also see that sometimes when you were 40 years old, your life is much more different than when you're 80 years old. So it's always a question about reassessing the need of it. I have some patients that are 95 years old, and they are still on the same antidepressant they took 50 years or even 70 years, and as they get older and get more sensitive to those medications, we need to reassess, is it still important? And we also need to speak with their family to know what has happened in the past? Were there many recurrences? Have they ever tried to stop it? Was it going well? Did it get worse? And then we can see what we do with the antidepressant.
One more quick one. So you go to your doctor, you have your checkups and whatnot once a year, your blood, whatever, and they all come back negative. Year after year after year after year. But they're telling you, oh, you got to stay on this medication for maintenance. What am I, a car? You know, I mean, if everything's working perfect, what's the maintenance all about? Why can't I just stop these medications?
It depends of the medication. It really, really depends of why this medication was prescribed to you. What are your comorbidities? Are there medications that are preventing more complex complications from happening, or are those medications being given to you just in precaution? So we have to always reassess, because sometimes the blood work is great, but I'll give you an example, okay? I see in my practice some patients that are taking medications to lower their cholesterol. And I also see some patients that are taking aspirin to, and then I ask them, why are you taking aspirin? Oh, it was prescribed to me when I was 30 years old. Okay. Did you ever have a heart attack? Did you ever have a stroke? Are you known for claudication, difficulties walking? And if it's not the case, and I cannot identify a strong indication for the aspirin, I will be speaking with the doctors to see if there's any way to stopping the aspirin. It really is a case by case.
Thank you.
You're welcome.
What are the chances of getting an ulcer taking 80 milligrams of baby aspirin a day?
Okay. Yeah, so it depends if you're taking other medications and if you also have had a past episode of bleed, or if you have peptic ulcer disease. It really depends of the whole portrait, okay? But for some patients, you're taking aspirin and you're not taking any other medications that can increase your risk of stomach bleeds, everything will be okay. But if you have some medications that can increase your stomach bleed and you're taking aspirin and you're over 75 years old, then there's a risk of gastrointestinal bleed. And it's a potential that we give you something to reduce the acidity in your stomach to reduce the gastrointestinal bleed. Again, this is a very summary answer because it depends of the whole condition of the patient.
Would you suggest that they speak to their chemist at the drugstore?
They should definitely speak to their pharmacist about that, yes. Yes.
And along the similar line, my GP often prescribes an extra medication with antibiotics because those antibiotics are strong. Extra medication is to protect stomach or intestine lining. I often forget to take that extra pill. Is that okay? What is the consequence?
Okay, it's okay if they forget. It can be helpful for some people because antibiotics, they change the gastrointestinal flora, so you have more chances of having bad bacteria that's growing in your intestinal lining, so more chances of having also loose stools. So by taking those probiotics, it may help you, but you cannot take them at the same time because or else you're canceling the effect of antibiotics. And if you're taking antibiotics already 3 times a day and you need to add that fourth timing of medication, it can be hard to do. So it's okay if ever you forget, you just have to monitor side effects of the antibiotics. If it's a probiotic that was prescribed to you, because that I don't know.
It was so very informative. And I do suggest you check things out with your chemist or pharmacist because they sometimes know more than the docs do.